Back in the early 2000s, I was studying osteopathy in the UK. And looking back at that 5 years degree, large sections of it were based around outdated and pseudoscientific principles and theories, concepts that have now been heavily challenged and don't align with 2025 clinical practice. And this is why we publish so much research and write so many books, because it's okay to change your mind and your views. We do this to make sure that we evolve with evidence-based medicine, best clinical practices, and best patient care. So let's look at motion palpation. Let's rethink traditional practices. This little chat is based off our recently published research, co-authored by with Brogan Williams, who's a New Zealand exercise physiologist. And we came up with this after seeing so much misinformation and pseudoscience on social media when it comes to guru therapists pretending to have these magic Harry Potter type hands. So let's have a little look into the motion palpation research and the importance of evolving our understanding within manual therapy. We're going to challenge some long-held beliefs, examine current evidence, and discuss why being willing to change our minds and think again is crucial for our professional growth. Now, for decades and decades, motion palpation has been the cornerstone of manual therapy assessments. Many of us were taught that we could feel specific vertebral misalignments and correct them with precise manipulations or adjustments. But here's the fascinating thing about science and research: it constantly evolves, and so should our thinking. Let's start with what can we actually feel. Although our hands are remarkable instruments equipped with 4 types of mechanoreceptors, the density of these sensory organs is highest in our fingertips, about 241 receptors per square centimetre, compared to just 58 in our palms. Now, while this gives us incredible sensitivity, it also has a sort of definitive limitations. Research shows that we're only accurate about 50% of the time in identifying specific vertebral levels. So if we think about that, we are essentially at the level of chance. And when we attempt specific manipulations, cavitations can occur up to 14 centimeters from the target area. Now, this is not a criticism of our skills. This is simply the reality of human anatomy and biomechanics. Now, do you remember Fry's Law? Many of us learned these as gospel, but modern research shows that spinal coupling patterns are far, far more complex and variable than these laws suggest. They change based on spinal regions, individual anatomy, posture, and loading conditions. There's so much variation. We need to sometimes to critically think and challenge ourselves in what we have been taught, and the importance of intellectual humility and the courage to question our deeply held beliefs. We don't want to keep doing the same stuff, especially if it's been disproven. Now, as healthcare professionals, we often fall into what's called an expert trap, the tendency to become so confident in our knowledge that we stop questioning and learning. So how do we realistically move forwards? We have to by adopting a scientific mindset, approaching practice with curiosity rather than certainty. Now, this means embracing uncertainty, viewing our methods and hypothesis as just that, hypothesis ready to be tested, being willing to update our beliefs based on new evidence, and celebrating the opportunity to learn rather than defending outdated principles. Current evidence supports a comprehensive assessment approach. We think about motion palpation and we need to start with a detailed patient history. We can perform static palpation, focusing on pain provocation, which is statistically more reliable. We need to look at active ranges of motion, also include passive ranges of motion with motion palpation, evaluate surrounding tissues and structures, incorporate dynamic functional testing as well. So instead of trying to feel these minute vertebral movements, rather focus on identifying gross restrictions and functional patterns. Remember, you're not failing if you can't feel what you were taught to feel. You're actually aligning with current scientific understanding. The power of I don't know. Saying I don't know or I might be wrong is not a sign of weakness. It's a sign of wisdom. In manual therapy, this means being honest about the limitations of our assessment methods while still recognizing their value as part of a broader clinical approach. The future of manual therapy lies not in defending traditional beliefs, but in integrating new understanding with clinical experience. We need to think about updating our educational approaches, embracing evidence based practices, focusing on functional outcomes rather than structural models. Maintain intellectual humility. Remember, the goal isn't to abandon motion palpation, but to understand its proper place in modern clinical practice. The key to professional growth isn't in being right all the time, it's in being willing to think again. We're not dismissing or diminishing the value of clinical experience, we're enhancing it with better understanding. So, by combining our hands on skill with current evidence and maintaining an open mind, we can provide better care for our patients and continue to grow as practitioners. So, I do encourage you to examine your own beliefs about assessments and treatments, what you're doing to the patients. What assumptions might you need to rethink? How can you integrate updated understanding into your clinical practice? So remember, the willingness to think again isn't just about changing your mind, it's about keeping it open to continuous learning and improvement. If we don't change our mind, critically think, challenge old health beliefs, we are still going to be using theoretical concepts that are over 100+ years old and don't align with current modern medical theory, scientific research, and current evidence based clinical practice. So just think, can we change? Can we think again? Can we do better?